everybody, it's Olivia with Freedom at the Mat. Thank you so much for joining today's Well Chat, where we're going to talk about how you create a well womb for your baby. Our guest today is a nationally renowned expert in women's wellness, Dr. Veronica-Gillispie Bell. There is no better person to speak with us today about how to create your well womb for your pregnancy. And if you're like me, you're outside of those childbearing years, perhaps you have a child, a daughter, a niece, make sure that you take this knowledge and share it with her as well. So I'm going to walk through who Dr. Veronica-Gillispie is because she is an incredibly accomplished woman. She's a board-certified OB-GYN and an associate professor for Ochsner Health in New Orleans. She serves as the senior site lead and section head of women's services at Ochsner Health Center Kenner, and serves as a director of quality for women's services for the Ochsner Health System. And she's also the medical director, listen up, of the Minimally Invasive Center for the Treatment of Uterine Fibroids. We all know so many women are suffering with fibroids. She's a leader in research and a practitioner in this space as well. In this role, she leads initiatives in the state of Louisiana to improve birthing outcomes for all people in the state, and specifically to eliminate the Black-white disparity gap. Welcome today, Dr. Veronica-Gillispie Bell. Hi, Dr. Veronica.
I'm doing great. Thank you.
Thank you so much for making time for us today. We're going to get right into it. It is all about how we can create a well womb for our baby. So the first question I have for you is, what changes are natural? What changes can I expect to feel when I become pregnant, emotionally, mentally, and physically?
Thank you, Olivia. Thank you for having me on the Well Chat. So every woman is a little bit different in what she experiences. From a physical standpoint, many women have a tired like none other in the first trimester because of those hormone changes. But it does get better. Once we get into the second trimester, then those symptoms go away. Nausea, vomiting that we may have had in the first trimester, that usually goes away. And so we start to get our energy back, and you almost forget you're pregnant. And so things feel really good. Then when we get into the third trimester, we start to feel more pelvic pressure, a little bit more fullness, may even start to feel some back pain. And those things are normal. But we also have that reassurance of now feeling that baby move, and feeling really happy about the pregnancy. But those physical changes are normal. Now, there are a lot of emotional, mental changes that go along in pregnancy as well. A lot of that is due to hormone changes. I wanted to make it clear that even though we say postpartum depression, those symptoms and those emotional changes can even start in pregnancy, a lot of times even in the third trimester. And it's okay to not be okay. So important for us to understand that as women, acknowledge that as women, and seek care when we are having those symptoms. But those are also normal to sometimes have those feelings of not being so happy during the pregnancy, which I think a lot of times also then brings us guilt. But again, those feelings are normal, and those emotional changes are normal. And it's important that you talk to your provider as well as your partner about how you're feeling.
Thank you so much. And you mentioned postpartum depression. It's real, right? Is it real?
It is real. It is very, very real. I think we don't talk about it enough,
Mhm.
especially in our Black community, where we are
Right.
made to feel like we're supposed to take on the world. We're supposed to be strong, not to show any signs of weakness. And we feel that when we are having depression and having those symptoms, that it's a sign of weakness, and it's not that. We call the different type of mood disorders that we see after pregnancy the perinatal mood anxiety disorders. And there's a lot of different emotional experiences that we have in that. First, we have postpartum blues, and about 80% of pregnancies will experience that. Those symptoms will start at the delivery time up to 2 weeks postpartum. And it's those feelings of being overwhelmed, of feeling guilty, of excessive crying. And those symptoms, again, are common 80% of pregnancies, and they resolve on their own. Then we have postpartum depression. That can happen anywhere from 2 weeks after delivery up to 1 year. And the literature shows that that occurs in about 25 to 30% of pregnancies. I actually think it occurs more often. I think we don't do a good job as providers screening for it. But those symptoms are also feeling overwhelmed, but excessively feeling that way, not wanting to take care of yourself, not wanting to take care of the baby. It can even go along with having thoughts of hurting yourself or hurting your baby. And if you're having any of those symptoms, it's so important that you do seek care from your provider. And again, we should be as providers screening at 2 weeks and definitely at 6 weeks. And now the American Academy of Pediatrics actually says that pediatricians should be screening the caregivers at that well baby visit 1 month, 2 months, 4 months, and 6 months. But you yourself, if you start to experience those symptoms, whether you've been screened or not, it is time to seek care from a provider. And it's okay to not be okay.
Are there things, Dr. Gillespie Bell, that we can do to ensure we have a healthy pregnancy, right, for the creating that womb? And also, so part two of that, separate, are there ways we can help to prevent getting postpartum depression as well? So, two-part question there.
Sure. So it is so important that we seek care before the pregnancy. So we need to make sure that we are optimizing any medical conditions that we have, hypertension, diabetes, really any medical conditions, history of depression. We want to make sure that we are in the best physical state to go into that pregnancy because we've already mentioned there's a lot of stuff that's going to be changed and a lot of stuff going on. And so we want to make sure we're in the best shape. That means also making sure that we are dieting, not dieting, but we're watching our diet, that we're exercising, and that we really are creating the best health for ourselves as we go into those pregnancies. Now, there's not anything necessarily that we can do to prevent postpartum depression. We do see decreased rates of postpartum depression in those individuals that breastfeed. It creates that bonding with the baby, and that seems to be somewhat protective, but not anything that we necessarily can do. I think what's important is that we understand those signs and symptoms of postpartum depression. And again, understand that it is okay to not be okay and to be able to seek that care when we are starting to see those symptoms.
Thank you so much, Dr. Veronica-Gillispie Bell. You've given us so much information today, not only about maternal mortality, and I learned so much. I did not realize that maternal mortality isn't just about dying through childbirth, but up to that year afterwards. So thank you for helping us understand, like even the social determinants and the disparities. I didn't realize those stats, and I'm not sure if our community did as well. So thank you for that. And also thank you for all the insights around how we can create a healthy womb for our babies. Our last question for you is if anyone wants to find out more, follow you as you share more information, and how can we just support you, which platform should we find you on?
Sure. You can follow me on Twitter at NOLA OBGYN. I'm also on LinkedIn. You can just find my name, and I'm on Instagram as well. But more importantly, do follow me because I do many interviews like this that I will release out and give more information and give more perspectives. But most important, I want women to understand that they are informed consumers in the healthcare process. If your voice is not being heard, if you are not getting the information that you need, if you are not being valued, it's time to seek care from another provider. You do have that ability, that authority. I give you permission to get a second opinion if you need to.
Yeah.
But it's so important that you are able to feel like you're being heard because we also know that that is a driver of those disparities that we see in maternal mortality, just not being heard.
Thank you so much again for joining us today. May God be with you, and we'll see you soon.
Thank you.